Hello, welcome to the WarmUp podcast. This is season 1, episode 2. Our guest today is Dr. Alfonso Morales. Welcome.
Thank you.
We're going to be talking about some things that he's doing as far as his practice. Will you tell me a little bit about how you got started?
Yes, thank you, Sandra. I am a family physician by background, and I've been doing this for 30 years now. And in the early 2000s, I started getting interested in pain and addiction because I saw a lot of people suffering from that. So that's one of my degrees. I became board certified in pain management in 2002, and then later on in 2008 in addiction, because of course people who had pain, a lot of these patients that I was seeing were dependent on opioids. It was sort of the beginning of the opioid epidemic in the early 90s. I got to catch it around after the late 90s, early 2000s. And so I thought a big need was addiction. But then I was frustrated at how patients were being treated in the addiction world. They were in and out of treatment centers, and I said, okay, something else is missing. And I got very interested in the wellness component of these patients. So achieve sobriety, achieve them to be off of medications, yet do it in a way where it was more holistic and wellness approach, meaning we took care of their hormones. Of course, patients who were on opioids for a very long time or even switched to Suboxone, we started running blood works and we started testosterone and hormones very low in men and women. So that kind of thought, well, if we can, if I can actually optimize their health, we can achieve sobriety more successfully. And yes, they did. And yes, our success rate went very high after doing that. And then, of course, me aging already. I'm aging. I just got 60, turned 60 last couple weeks ago. I was very interested in the anti-aging. So I started, I would say 15 years ago, getting trained in anti-aging.
Okay.
So
what does that entail?
Well, people call it differently. I mean, functional medicine, integrative medicine, there's different names, however you want to call them. Some people don't like to be called anti-aging because they think it might be a little bit of quackery in it. But now it's being more accepted, functional or integrative medicine, which means how do we become more proactive versus reactive? The kind of medicine that we see so far is more reactive. We don't wait until you're a diabetic or hypertensive to treat you. How about preventing that? Let's see, hey, when they're children, what is your diet? What is your nutrition? And try to prevent that progression to diabetes or hypertension or metabolic disorder that we're seeing so commonly nowadays in the U.S.
Yeah, that makes total sense. With what you found, how do hormones play a role in that?
Huge. I mean, the peak of longevity, I tell all my patients, the peak of longevity is 25. That's when nature and God says, start getting out of the way so that the younger ones can come and eat and reproduce, right? So how do we start aging? That decline is in the decline of hormones. All hormones start declining, not just estrogen in women, but you have testosterone, progesterone. Men start losing testosterone. It's a slower process than women, but it's becoming quite sharp now in the last decade. And we're seeing declines in just about every hormone, thyroid. So there's an interest in treating women, of course, with menopause, but in men there seems to be some resistance around it because of the stigma that testosterone has had in the performance and athletic performance. So that's another talk, but what I've seen is that it's very, very important to optimize these hormones as we get older in order to achieve longevity and vitality as we age.
Do you feel like the general practitioners are missing the mark on this?
Absolutely. So there's the medicine that's called, I call it the mainstream medicine, the reactive type of medicine. Typically, you go to your family doctor, you get checked, hey, I want my testosterone checked, and they'll say, even if it's low, they'll say, no, it's okay, it's part of aging. You don't need testosterone, you're okay, just keep on doing what you're doing, eat whatever that means, right? Have a good nutrition and exercise, right? Well, whatever that means, right?
Good nutrition.
Yeah, and usually it's already a provider that's out of shape, him or herself, giving advice. So it's not the best experience. And so they come to people, that's why we come to people that are more proactive, like ourselves, where, hey, can you look at these hormones more carefully? Can you look at this biochemistry, at these labs? How can I become my best? Because many times it happened just last week. Patient came in and said, I went to my doctor and he thought I was depressed and he gave me an antidepressant. No, that's not what you needed. Your testosterone is low. Okay. We need to treat it. And yes, you're hitting your 40s. Yes, it's coming down.
When somebody starts taking testosterone, like you said, the stigma with it, the side effects, what are normal side effects versus what someone perceives it to be?
Yes, so testosterone is a hormone that is pro-inflammatory by itself. So it is very, very important that whoever wants to embark in taking hormones always sees a physician that's an expert on this and will get labs as well. We need to make sure we get labs in order that we're in the sweet spot when it comes to replacing the hormone, because it's not over supplementing like we see in the bodybuilding community or in the sports enhancement community. It's not sports enhancement. It's more about optimizing your hormones at a right sweet spot, I call it, where it's not going to cause too many side effects. Because yes, there are side effects. There's no question about it. One of them is, you could have potentially testicular atrophy, lack of fertility. You can have acne, loss of hair, acceleration of hair loss. There's different things, and even if you're a drinker or an alcoholic, stress your liver in ways that you don't want to see it, because now your lipids come down, your lipids look like the bad cholesterol goes up, HDL comes down, something you don't want to see, that your cardiovascular risk can go up. But testosterone, contrary to what people think, there's a stigma that can cause heart attacks. Mm-hmm. Well, the most recent literature shows it's quite the contrary, that testosterone is protective, given in the right level.
Right.
It's protective, especially because it will have you gain more muscle mass. And guess what? Muscle mass is very important for longevity and vitality as we get older.
I've seen a lot more literature on that specific
Yes.
topic.
Yes, it's actually protective, in the sweet spot. Actually, I talked to a friend of mine who's a specialist in cardiovascular. He's a cardiovascular surgeon, and I asked him, what is the sweet spot for testosterone? And he's out east, and he said, don't go over 250 milligrams a week, basically. So that was, and this is a well-trained cardiac surgeon that knows what the risks are with testosterone, and so we have quite a bit of leeway still.
And it's just based on somebody's chemistry and
right.
where they are.
Exactly. So some will do okay at 80, 100 milligrams. As we get older, we might not need as much, but we all need some testosterone, including women, by the way. Women do need estrogen, testosterone, and progesterone in the right balance. That's a part of our treatment. When we treat aging women, we always give them testosterone. My mother has also, she's 85, 86, she's on low-dose oxandrolone. So that helps her preserve muscle mass, reduce sarcopenia, reduce osteopenia, and give her more vitality in her 80s.
That's awesome.
Mm-hmm.
Now let's talk a little bit about you.
Yes.
So exciting. You just turned 60.
Yes.
And you look like this. How long have you been working out?
Well, I've been working out off and on for many years. Since I was a teenager, I've always been an athlete. I mean, I did different sports. I did some tennis, soccer. I was always in the martial arts. Martial arts is actually what made my body develop a lot more. And then I got an interest in weights probably in the late 90s, where I really got more serious about it. And but never went, I went 2 or 3 times a week. I was still weak, I didn't get, it took me a while to find the right trainers and because I was so busy in my profession that I just didn't have time to the train. There's no excuse, but life gets
Where your
ahead.
priorities were.
Yes, but I still lived a very healthy lifestyle, and so I was able to build some muscle throughout those years. And then, just in the last, I would say 5-6 years, that I really pressed hard. Okay, I'm going to work out 4 or 5 times a week with weights, with the trainer, and have some accountability.
Awesome. And are you doing anything coming up? Do you have any goals?
Yes, as a matter of fact, I'm training for the TCO, Twin Cities Open, for Masters Division, 60. I'm doing, a lot of people when I talk about it, you're crazy, you're 60. Well, no, I'm not crazy. I'm going to see what happens. So we'll just do the very best, no matter what the results are. It's not about results. It's about just showing my very best.
And having a goal to work towards.
Goal to work, yes. I think that's how I work. I need goals to accomplish things.
I think most people do.
Yes.
And I don't believe that there's a deadline on your goals or dreams or aspirations either. I don't know that 60 is a limit.
Yeah.
I think until you're not able to do it or don't want to, that's where you should stop. But
Yes, I think age is just a number. You want to feel as best as you can.
yes. So let's talk a little bit about the other services you offer at your clinic. So HRT.
Weight loss. So weight optimization. And I don't like to call it weight loss. It's weight optimization. Why weight optimization? Because a lot of these clinics, they're giving, for example, the latest craze is semaglutide, Ozempic or Wegovy. A lot of people know it by those names, or Mounjaro, which is tirzepatide. These are quick peptides. You can get it once a week and you lose weight, right? And everybody's talking about it like it's the best thing in the world. But the problem with that is if you don't do it with adequate nutrition, with the adequate exercise behind it, weight resistance, it may have worse results. Because now you turn into a skinny fat. Basically, you lose a lot of muscle, and you lose fat and weight, but you lose at the expense of a lot of muscle loss.
How does it cause muscle loss?
Well, because the caloric restriction, basically how it works is it will make you eat less, have less appetite, so you're going to eat less. No question about it. So that's why it's very important to give you the right nutrition, right proteins, and the right timing of it, so you don't have the side effects of throwing up or having gastric paralysis and fats until the last. Because you can actually you will preserve muscle mass by just certain tweaks on nutrition and exercise that can do that. But any type of caloric restriction, as you well know, will cause some. We know in the bodybuilding community, you will at the expense of some muscle mass loss.
Okay. I guess that makes total sense. How long have you been doing the weight optimization?
So weight optimization, we've been doing it for several years, probably the last 2 years. It became even more intense after the introduction of Ozempic out there, where people were now calling, hey, I want to try this peptide, I want to try that, to help. A lot of women were coming in for quick results. I want to just lose weight no matter what. Well, it's not about just losing weight. We got to explain it that we got to preserve your muscle mass as well.
Right. The lifestyle change.
Lifestyle changes, yes. Very important.
You mentioned peptides. Now, these are peptides, but there's a lot of other peptides that are useful as well,
Yes.
right?
Yes. There are peptides that are not, first of all, peptides have been around for decades. We have insulin, that's the most common peptide out there. There's many peptides that we use, including growth hormone analogs that many of them are not FDA approved, yet we can still use them. And what they do is they work like that, growth hormone analog. They optimize or stimulate the pituitary gland to optimize the production of growth hormone. As we age, we get older, we need, our growth hormone comes down, so our rate of recovery is not as best as it was when we were 20. So in order to improve that, we give certain peptides to help that growth hormone get optimized. And then some experts say that once you hit 60, maybe it makes sense to be on growth hormone as well.
So prior to then, just using the analog.
Analogs, yeah, like CGC ipamorelin is one of them. There's sermorelin that's out there. Tesamorelin, which works more in fatty oxidation. It actually was FDA approved. It's still under a different name. Ingrifta, it's called. That was used in the HIV lipodystrophy because people that were taking antivirals back in the day were getting having metabolic issues and getting fat around the midsection. So tesamorelin would help you burn that fat and get
very
leaner.
Specific to that midsection.
Tesamorelin, yeah, it works very much in visceral fat and midsection fat. Tesamorelin is a amino acid sequence of the part of growth hormone that works on fatty oxidation.
Okay. And then the other one you mentioned, the ipamorelin. What is the
CGC, so there are two peptides. They work synergistically, or they work together. And what they do is they are also analogs of growth hormone that basically stimulate the growth hormone. CGC is more long-acting, ipamorelin is more short-acting, so that's why they combine both to work better.
Okay. Awesome. There was something else I was just going to ask you and I just forgot. What is your next goal besides, so you've got this show coming out? Do you have any goals besides that?
Well, from an athletic standpoint, we'll see how the body takes it. For me, this is kind of an experiment too. I see how, because after my experience, I would like to perhaps write a book about how bodybuilding can be done in a safe way, especially in the aging population. It's definitely not the same, the way we absorb our gut, and that's a whole different conversation, gut health. Our gut ages, and we have to adapt correctly with certain probiotics and foods, and timing of meals are very important, and how much we eat. It all changes very much. It's not like what we know from bodybuilding that is more applied to the younger population. You have to apply it to, you're no longer 20, 30. Right. How do you still maintain youthfulness, but in a way where you're actually hacking on the aging body? So that's something I'm passionate about, and I'm finding out myself, surprisingly, how my body, for example, oxidizes fats, and how I'm more metabolically efficient in burning fats, and versus perhaps what the trainer would say, So it's based on younger population.
Yeah, you're right. And it's definitely geared like that 25.
Yes, and women too. Women actually are a different. If a trainer does not understand how women's physiology works around hormones and period and the whole cycle, and you know that perhaps. I mean, there's times when it's more efficient to train like this and like that, in the food and the meals and the foods that you have to eat. So it's more complex.
It is. Going back to the hormones, so like talking about women with progesterone, estrogen. With estrogen, there's like other makeups of that. So
yes.
Like estradiol.
Yes.
When you break those down, what age do you think that you see the supplementation needed for females?
It's as early in your early 30s, by the way. That's early 30s. Yeah. Then you think you want to do it in the premenopausal time. And yes, you're right. We combine estradiol with estriol, two compounds that are important to counteract. So the reason there was for a while, and my mother suffered the consequences of that, and women around her age, is that the World Health Initiative program in the 90s came out with some data showing that estrogen caused breast cancer, and estrogen to women caused breast cancer. A lot of guys in the mainstream said, nope, we're not giving any estrogen, and women were suffering hot flashes and all the consequences of that for many years, until finally that data was disputed and clarified, and wait a minute, it's not like we think. So estradiol and estriol conjugate, that information showed that estradiol was highly or possibly carcinogenic. But when you combine it or balance it with estriol, which is a different kind of compound, it helps it to actually even prevent cancer, breast cancer. So if you use both together, and we use topicals or it could be injectable, estriol and estradiol can actually work synergistically and prevent cancer, breast cancer. So that's one thing. Then you combine it and balance it with progesterone. In certain women, they don't need as much progesterone until after 35, 40. That's for sleep. Progesterone is great for sleep. Okay, because many women suffer from lack of sleep or poor sleep. That is because progesterone is coming down.
I've had a lot of clients of mine, female, usually 40s, complain about insomnia.
Yes.
I'm assuming that's probably part
That is part of it. That's part of it. It's all evolutionary. Women are supposed to be always on guard, kind of taking care of the offspring, right? And it's just an offspring, it's from what the upset from that. So progesterone will help that significantly, and as you get older, you're going to need a higher dose of 25, 50 milligrams, and 100 milligrams. And then obviously combine it with testosterone. Testosterone has to be 1%, 2%. It's not much. You start with 10, 20 milligrams a week. That's what it comes to, which will help a lot of women who are in the aging process where, wow, I'm losing weight, I'm getting leaner, my body's actually recomposition.
Instead of that weight gain.
Yes, fat and inflammation around the arms or glutes, that whole will come down.
I've noticed people with the trunk especially.
Yes. So it's very beneficial for that, and women just won't stop taking it because they feel much better. Now, if you're training in a competition, there's a whole different way to do that too, where now you have to really balance the hormones every 2 months, but making sure that your hormones are not too off.
Well, with the cortisol levels that come with training to just the stress you put your body under.
Yes, and women require. Not that men don't require it, but women require much more sleep in terms of recovery.
And for sleep, okay, so how much is optimal for a female versus a male?
For a female, 9 to 10 hours.
Really?
Hands down, yeah. Hands down. For guys, no matter what guys tell, including myself, we need at least 7 to 8 hours of sleep. Yeah, 7 to 8 hours. And I would say, in my case, probably I need more, 8 to 9 hours. But in average, that's what they say, 7 to 8 hours versus women, definitely 9 to 10 hours. Women need sleep. And in order to recover and grow, you need to sleep. Yes? Yes.
I'm missing that one.
Yeah. And aren't we all? And if you want to reduce those cortisol levels, you got to sleep. Because otherwise, if you're not sleeping, cortisol will start creeping up and up and up. There's ways to offset that. We use DHEA, in women 5 to 10 milligrams to kind of reduce that, and adaptogens for adrenal support, but still nothing like sleep. Nothing like sleep.
Natural, just natural.
Natural, yeah. Chamomile tea, perhaps when you go to bed, or adaptogens are very good for reducing cortisol levels as you go to bed, and progesterone.
What is your thought on ice baths for cortisol levels?
I'm not a believer in ice baths very much. I think it's too, the cortisol levels go up the roof when you're going, and it's a shock. I know people talk about it, and you'll see everything on social media from those that are against it to completely opposite. So really, that whole thing with the ice baths and cold baths came based on some research that they were studying animals and people, that how can you burn brown adipose tissue. Brown adipose tissue is the kind of sort of the good fat that we have, that babies have, for example, when they're born. And if there was better ways to kind of burn that fat, or how to, but the studies show that it had to be cold temperature for at least 2 to 3 hours. So you had to be exposed for 2 to 3 hours at 45 to 50 degrees where it had some benefit. So somebody who was very creative said, well, maybe cold baths will work, and they made it a big thing. Some people sell it as, oh, you need discomfort. Yeah, you need discomfort, but I would be very cautious. I mean, younger people probably can do it. It's no problem if that's what you love to do. But as we get older, it's not a good thing to see those cortisol levels go that high, and your heart rate can actually go into shock. So
that's not good.
And that's not good. I certainly don't want to be that individual, so I rather not do it. Okay. I rather maybe run without a jacket on the cold that's enough exposure to kind of make it uncomfortable and make it probably beneficial. But I don't need a cold bath.
Yeah.
I don't need to be at freezing 35 degrees on ice like this for, I think we went a year ago, 2 years ago, we saw going down the ice baths. He had a digital watch, and we could see his heart rate go from 70 all the way down to 30 or 40. I said, I don't want that. And he was wearing a wearable digital watch, and we could see his heart rate go down. And I said, I don't think this is the best thing.
No, so the heart rate dropped that much.
Yes, that much, and very quickly. So if you're younger and you don't have cardiac issues, I think, and that's what you enjoy, that's great. But as an older individual, I don't think you need to do that. It doesn't have that much of a, to me, benefit, yeah. Yeah.
As far as other recovery methods, what do you think, besides sleep?
Yeah, so if you're working out, and I'm assuming you're working 4 or 5, yes, sleep is number one. Adequate nutrition and the timing of that nutrition. So you want to make sure you get, and you know this, simple carbohydrates right after you, so those carbs can go into your joints and then into your muscles. You want that healthy benefit of carbs going right in. Adequate fluids, recovery, and then the rest. But yes, there are things you can do, multivitamins, you can do adaptogens, and massage, body work, stretching, cupping. You may see here some cupping here. Yes. Yes, that is actually, I didn't believe in it until my fiancée Elizabeth introduced it to me and said, you gotta give it a try. I've seen it with the Hmong population, the Asians, and they all talk about it. And I said, there's got to be some truth because it's thousands of years they've been using it and sure enough, it does help. So I think that's a great way. And good massage therapists, not just a smooth, relaxing massage therapy. You need a sports massage, somebody that really knows what they're doing to help. Stretching, for me, that's a big thing, stretching, because I'm so tight. And naturally tight, that's how I've been all my life. And then making sure that there's doing that body work is going to help. To me, that's more beneficial than ice baths. I mean, again, if you like that and that's your thing, do it. Right. But I haven't seen much benefits from it.
From a medical perspective.
From a medical perspective. But there might be some recovery. There might be some improvements from it. I know people do swear by it. Another thing I forgot to say is shockwave therapy. We started working with a chiropractor that does shockwave. And let me tell you, that really improves.
So what does that do?
Shockwave basically is a technology that they used that came out from lithotripsy back in the 1970s. The way to destroy huge stones that were trapped in the kidneys was actually using high doses of energy in the form of ultrasound to destroy the rock or the stone, and then it hopefully would pass, right? Mm-hmm. So now they're using it for stimulating stem cells in circulation. So they can do it at lower rates of energy in the muscles, tendons, ligaments, and what it does is increases blood supply, increases it stimulates your own stem cells to kind of repair cells, so to speak, to come in and repair faster.
Okay. So
it does help a lot. It helps recovery quite a bit, and in my case, it has helped quite a bit in terms of when they does shock wave on my chest feels like it's full of blood, so looks pumped.
That's great. Could you do that before a stage?
I was asking that to him, and he wasn't sure about it. I think you can. There's no reason why you couldn't.
You just have to have him outside.
Yeah, you have him outside, do the shock wave in the arms, and show a little massive pump there. Yes, you could.
Yeah. How's posing going for you?
Posing is difficult, but I'm getting the gist of it. I'm trying to practice it.
Yeah.
And that's practice, and I have a good coach that's doing that and posing. She's virtual, but she's going to come in a couple months to come in live.
Oh, that sounds very good. How many weeks out are you?
Well, it's July 13th, so we're about 12 weeks, are we? 12, 14 weeks, yeah.
Real now.
Huh?
Real.
It's getting close. It's getting very close. And maybe, I don't know if I'll be ready. I want to do like a prep, do the Brewer City in Wisconsin, which is Is that
It's probably 4 weeks earlier.
June 30th? Yeah, it's 2 weeks before,
Oh,
June
2 weeks
30th.
before,
Yeah,
okay.
June 30th. It's just one Saturday, June 30th, and it's 2 weeks before because TCO is July 13th. Yeah.
Okay.
Yeah.
Yep, I did that one before the TCO, or not the TCO.
Yes.
I did TCO as well, but I did Bruce City and then I did TCO. And I did it kind of as warm-up as well.
Yes, yes. So I want to do it, see how I feel. Nothing is set in stone, depends on how I feel. You know, I don't want to push myself either, or my cortisol levels up, you know, or where I get to.
Create stress.
Yeah, stressed or moody or whatever. So I want to make sure that,
You stay even keel.
yes,
Yeah.
I don't want Elizabeth to suffer, right?
Or anyone else for that matter.
Yeah.
Very good. Is there anything else you wanted to add today?
No, I think the most important thing I want to say is there's a big epidemic out there, especially childhood epidemic. Two things that are really killing our population right now is the metabolic epidemic of obesity that brings diabetes and everything else, and then the drug use, substance use, whether it's alcohol or drugs, that comes from mental health crisis that's serious. And so I think just really tackling this part through proper nutrition, proper exercise, proper medical guidance, that's going to really give the best results in being proactive versus reactive.
Yeah, like you said, the reactive, they're just treating
Treating, yeah, here's an antidepressant. I mean, wait a minute.
It's a Band-Aid.
It's a Band-Aid. Now his sex drive is down, you know, with that because it numbs them. You know.
And then they feel nothing, and then you end up with other issues.
And now you need more medicines, right, for that versus, you know, hey, let's try this medication because perhaps, and I get it, they're not experts. People are afraid because of the literature or what they've heard or the stigma around hormones in general.
And I know, like, I've referred clients to some of my clients
Yes.
too, as far as for
Thank you.
because their primaries, say, like you said before, they're within range, so it's normal, but they're experiencing all these things, and instead of trying to dive in deeper, they just, well, just take this, and this is just normal. You should just suffer.
Yeah, it's part of aging. I mean, this one client or patient just said, no, he just told me it's part of, get used to it, you're aging. Well, I'm not going to get
don't
used to it.
have to accept that, right?
You don't have to accept that. You don't have to accept that. You can be more proactive in the right hands, yes, and do it safely. If you're going to take any type of hormone, I think it has to be done safely. And I'm a big advocate of doing bodybuilding as safe as possible. I know it's always been seen as an unhealthy sport. There's a truth to that. I mean, depends on how far we want to take it, but calm down. Let's try to do it as best as we can in balance, and it can be a very healthy, fun sport.
On that topic, there's been a lot of deaths in the bodybuilding community.
Yes.
And what is your opinion on what that's attributed to?
Well, it comes very much to what we've been saying here. I think a lot of them are pushing the limit of what a body can take physiologically, and they're being pushed also by their trainers as well that are not doctors, by the way. They may have experience in bodybuilding and doing things themselves, but they certainly don't have the biologic or medical training to treat people, on top of the fact that each individual is different. You can't have a cookie cutter approach to everybody. You really have to have labs, baseline labs, genetics, ancestry, medical history. Maybe this person has a medical history of having polycystic ovarian syndrome or something else. I mean, you got to really be careful about that. It doesn't work for everybody. So many of these people that are dying they're stretching the limit. By the way, a lot of them are cardiovascular deaths or electrolyte imbalances. A lot of them, they have diuretics before the show. They're really depleted, and now you're getting even more depleted with not drinking water, so the heart can only take so much. Kidneys shut down too.
Yeah. So just straight up organ failure.
Yes. It's very unfortunate. I mean, we've seen young people too, young men and women go away.
Both.
Yes. Not old, young.
No, it's alarming.
Yes.
And I know some people were trying to attribute it to the COVID vaccine also, that there's an interaction between the steroid use, if you will, and the COVID vaccine?
That I haven't proven. I haven't seen it. I think I'm proactive when it comes to vaccines. Get the COVID vaccine every year because that's the last thing you want, and the flu. But I'm not a conspiracy about theorist about vaccines. Get the vaccines. And in my case, I need the shingles vaccine too, by the way, if there's anybody out there of 60. Beyond 50, you have to get the shingles. But the idea is, no, this is just something that's been happening already for many years, but more so now in the last probably 5 to 10 years because of the event of more aggressive pushing of hormones, drugs, and performance on men and women.
And not really thinking about the repercussions long term.
Yes, yes. I mean, we're seeing physiques that we couldn't, 5 years ago we would never see. It's impossible. How much are you willing to push the body?
True.
That's where it's at, and that's where it becomes unhealthy.
You're not wrong. Well, thank you very much.
Thank you. It was my pleasure.
I'm excited to see what happens with stage for you.
Yeah, we'll see.
Yeah, and you guys are launching a podcast too, aren't you?
Yes, we are. Yes, we are. We're going to launch, Elizabeth and I are going to be launching a podcast fairly soon, and we'll start talking a lot about these topics and others around our clinic.
More in depth.
Yes.
Fantastic. Well, thank you again, and thank you for joining us at the WarmUp podcast. Stay tuned for Dr. Morales and more of his endeavors and his show. I'll be there.
Thank you. Thank you, Sandra.